A woman is the female partner in a marriage or a union, call it like that. So a woman in a family is the one who is supposed to carry a pregnancy. Now, when a woman is pregnant, meaning we say the couple is pregnant, and that is where we needed the man and the woman to come for antenatal services. The antenatal services are preventive services. It's not like you have already a condition. That's why it is to break answering the question of the women who do not want to attend antenatal services. I would say that is absurd, and it is their choice that they do not want to attend, since their rights, issues of rights alone. However, we are encouraged that all mothers, actually down in the lowest level of health center or health facility, is the VHT. The VHTs are sensitized to go and map. Mapping is looking which house in the village has a pregnancy, a woman is carrying a pregnancy, such that the VHT tells the mother you need to start going for antenatal. However, this issue of our culture, Lubara culture, where a woman is not supposed to tell even the husband that she has missed her periods, which could be a pregnancy. It's not that every time you miss a period it means you are pregnant. So which could be a pregnancy, meaning they then go to a facility to check if she's pregnant. So sometimes they do not want to tell their husbands or those around them or the family members that they are actually pregnant, until when you see the bump growing, baby bump growing. That is when they know they are pregnant, and then they are going for antenatal is really a choice. But in this case, we are encouraging all of the mothers who are pregnant to attend antenatal services. As I had said before, it is a preventive service that we offer to all pregnant women. Then about the complaint of male who are trying their best to come for these antenatal services, however, they get encounters with the health service providers, the midwives, for any unfair treatment, I would call it like that. I would not defend them for that reason that sometimes these men, it is a way in which a midwife could find herself presenting an issue that they observe in the mother. You find a husband will come with the wife who is pregnant but has not prepared the wife. In preparation, you will think of financial or feeding of this mother. Remember, in a pregnancy, the mother should feed well. Then at some point, there are some things that maybe in a facility you find maybe supplies are not there, and a husband should provide the financial support to the mother, that it is possible to acquire all these things that are needed by the health worker so as to provide a better service. So in this case, when you're presenting such an issue to a man, you might put it in a way that it makes the man feel demoralized, or is being abused, or is being used unfair language or unfair treatment. We really apologize for that, but they should take it in a positive way, because in the first place, you've taken the initiative, and we give thumbs up for such men that you have been able to take your wife to the facility to receive these antenatal services. And then the fact that you have tried your best to make your wife really presentable there, whichever way it is, I request that you take any communication to you that you see is unfair in a positive way, because in a way they are trying to tell you to organize yourself well, organize your family well. Remember, is a baby coming, a new human being is coming, and it's very delicate, and in this case both the mother and the fetus are delicate, so they want to prepare you for something which you might not be aware of, or it might be a complicated pregnancy, so they're trying to prepare you for that. Please take everything we tell you in a positive way. However, promise to communicate to our technical staff that they may improve on their communication. As you watch the skits, that it is our communication, sometimes the language we use that affects the way they present themselves to us.
My name is Gladys Eimaro. For me, I'm a pregnant woman. Now, today we are here at Iruba compound. We came here for attending launching of antenatal care. We heard all what they have been saying. So, right now we are still here because we were not feeling well. We were angry because the moment when we came here, up to now, we didn't attend what we need. For us, we as a pregnant woman, we have a special care. For our target was to come here for these midwives to come and check whether these fetus were good in our womb or not. So they didn't. We thought that they were going to give for us something to show that we came here to listen to them or else to get something from them, but they never gave for us. So that's why we are still here. We grew annoyed because of it.
But you know you have forgiven them.
Now, right, we grew very annoyed. Right now we forgive them, but next time let them not. Some husbands, not all. Some husbands, they don't want to take their wives for antenatal. The reason is that these husbands, some of them, they don't care for their children. That's why they remain at home. They're just pregnant in their woman. Let me say, Papa say, oh, I don't know. Others, they say that when we take their wives for antenatal, the delayment is so much they cannot stay for long. That's why they're leaving us alone. Now, my target today here is, like when I'm here, I go for antenatal alone. I need these midwives, not angrily, in peaceful way, to take their to take their phone numbers or else to write some sheets. We go with it, so that they will know that all men are needed where at the antenatal place, so that they will take us where to hospital to get proper attention. Like when you are pregnant, you should not miss your antenatal care days. Like when your stomach started pain, you should not go for these women who are attending us at the, let me say, village areas. You just go direct to hospitals or to health centers. Because when you deliver at home, anytime, the moment when umbilical cord remains inside your stomach, obviously you leave that kid which you have been delivered here, you die. Or else, the moment when you deliver well, you start to bleed in. It will be a problem for those people to stop or else to how to control that bleeding. It will be a problem. That will make us to what? We as a pregnant woman, it will make us to reduce our number and we shall die also.
My name is Afayo Victor. I'm a gynecologist and also coordinator for Arua Local Maternity and Newborn Systems. Yes, antenatal care is one package that we need to appreciate, that can be able to help us identify and also manage our pregnant women very, very well. And it is a concerted effort. Everyone is responsible for this. And surely we have noticed that our coverage for the first visit here, I mean, a woman who has gotten pregnant, and we expect that within the first 3 months she should have started going for services, so that we are able to start identifying problems with this woman and her baby early, and we're able to address them in time so as to achieve best outcomes of pregnancy. And in doing this, we wouldn't like to see this woman alone. We would like the partner, first of all, the male partner, to get fully involved. We have seen actually that pregnancies where men support their wives end up very well, and actually the outcomes are so good. Even up to the time of giving birth, we have men who have gone to the labor suite and they have given support, encouraged their wives. The outcomes are usually good. For us as health workers, we usually get impressed by those occurrences. But those who are not supported, even right from antenatal care, we realize changes of moods. Most of these women have mental issues. And I can tell you where a woman has developed mental challenges simply because she's not getting enough support. Automatically, towards the end of this pregnancy, we start getting problems, and then even the outcomes in most cases are not good. You will find a baby is dying, or a baby comes out very poorly, maybe scores very low, and it ends up also in the neonatal care unit. The couple takes very long to sustain all the stresses of this baby's ill health and so forth. So we really would like to have the hands of men. Just the same way we have started this relationship in love, and it has culminated into the pregnancy, this must be carried on. Even we do believe that when babies are inside the womb, they start getting the love from the parents right from there. Baby gets to even know that my father is looking after me, my mother is looking after me, because any stress on the mother is transmitted to the baby. And we see the quality of children we bring out is not a very good one, simply because we have not taken care of them very well when they are inside the womb. And therefore the advocacy for male involvement is so real, and I would like my counterparts, the men, to really join hands with their wives and ensure that we carry on this one together. And that's why we are saying, I am her keeper. And therefore, being her keeper starts from you, and let the community or family members see it from you as the man. And we do this together, and the joy definitely at home there will be to everyone. So that is it. And I would like to advocate that we should get deliberate moments to sit with the men. You know, most of our packages have been that we look at the women so much, and coming to the clinic is difficult for the men. So we would also wish to sit with the men at different forums to see if they can give us information on why probably they are not coming up. Maybe some of them have genuine reasons. Others are doing works to ensure that each day there is food on table. We appreciate that. But if there are challenges that they are meeting, that is making them not to support their wives or not come to the health facility to attend this antenatal care, we discuss together and we create way forward so that no one is left behind. We really want to be for these women and be their keeper. And at the end of the day, we enjoy the fruit of the pregnancy together.
My name is Dr. Ronald MEDIA-Robsyiti. I work with the Ministry of Health as an Assistant Commissioner for Health Services in charge of health promotion and strategic health communication. Today we have just launched a campaign which is geared towards promoting antenatal care first visit in the first 3 months of pregnancy. Antenatal care is the care given to mothers who are pregnant to be able to ensure that their health is checked thoroughly well before, immediately they get pregnant. And this benefits them in a number of ways. One, there are diseases that can actually affect the outcome of pregnancy and therefore birth. Diseases like malaria, things like sexual transmitted diseases, including hepatitis B, including syphilis, and also HIV. These can tremendously affect the outcome of the pregnancy. So when you get these mothers, you screen them for nearly everything. You take their blood pressure to ensure that they do not have pressure, because sometimes they develop pressure which can actually cause the mother to actually abort. There are other conditions like diabetes. There are conditions like malaria, I've said hepatitis B, HIV, AIDS, and many others that we screen for. And once you screen these conditions, it now helps the midwife, the healthcare worker, to know how to handle this mother. Previously, we used to ask them to come to us at least 4 times. But since we have changed that policy, we want the mothers to come to us as soon as they discover that they have missed their period. Of course, if you're in the productive age and you have missed your period, we always say you are pregnant unless proved otherwise. And therefore, we would ask them to come and test with us. Once they are pregnant, then we enroll them and we start giving them that care. And this scientifically has been proven to do a lot of wonders in as far as the outcome of birth is concerned. One, this mother is going to have contact with the midwife or the healthcare worker to be able to assess them. You know, once a mother is pregnant, this mother is not now alone. This mother is taking care of two lives. The life inside is demanding a lot in terms of nutrients, iron, folic, and that therefore means this mother's nutrition needs to be improved. She must feed for herself and also for the baby and for her good health. So we need to monitor this. Once we realize that her health is not up to date, then we try to do supplementation. We try to see that whatever should be corrected needs to be corrected. We also monitor this baby from the time of inception, during the time of the 9 months period, to ensure that this baby is growing normally and there are no abnormalities, because we now have machines which can be able to detect any abnormalities at the earliest possible opportunity. Where it can be corrected, then we correct it. So all these are actually done to benefit the mother. Why? Because we want the mother to give birth to a baby who is healthy.
And they evade, the responsibility of taking them for antenatal services.
Yeah, traditionally, the man is actually a very difficult person and is I must say proud. I may mind myself, but I think traditional, we African men are very proud and a bit rigid to changes. The reason why we want men to accompany their spouses is because now with the advent of hepatitis B, HIV, and many other conditions, once you screen together, once you are given education collectively, it helps you to support each other. You know, a mother who is pregnant is very delicate. And she's delicate, she needs a lot of support. She needs psychosocial support, she needs emotional support, she needs financial support, and all the support from the spouses. And therefore, if the mother goes alone and she's given all those educative information without the man who actually controls nearly all the resources in the family, getting to know exactly what this woman is supposed to do and how she's supposed to be helped, then we are actually not doing much. But when they come as a couple, definitely we try to counsel them. We counsel them, and specifically the man who controls most of the resources, that this woman from time to time may need to prepare for birth, because birth preparedness plan means there are certain things the mother needs to have, and things like good clothing, the baby towels, those things for the baby and also for the mother, those are things that need to be prepared and it needs money. So if the man doesn't come, then you can be sure once the lady tells him that this is what is required for our birth plan, the man may not accept it because it costs money. Also importantly, once we screen a mother or a couple, we discover that there are some health challenges, then we enroll them to care. For example, if they have HIV, they have hepatitis B, one of them has, then we'll see how we can help them. Because as I mentioned from the speech, that getting HIV/AIDS or being HIV positive is definitely not a death sentence now. But that is also not enough to say that we should be complacent. Whereas we have medicines that we can take and sustain these people for the rest of their life, we think we need to ensure that we avoid contracting HIV/AIDS. Practices that can lead us to getting HIV/AIDS need to be avoided. And therefore, the healthcare workers will actually counsel this couple, and they will be able to have their questions all answered, because I'm sure they will have questions to ask. And that for us is very important. So what in brief I'm saying is male involvement in healthcare service delivery, male involvement in antenatal care, which ultimately gives rise to the outcome of birth, is very important. So we should encourage that. I know the male involvement is not very, very good as would have expected, especially in the country, but was still in the West Nile. But we think by continuously talking to the male counterparts and letting them know the benefits of accompanying their mothers, maybe eventually they will come there. So I want us to continue encouraging the men to accompany their women, and that's why we've started with the men who come with their spouses. We give priority to them so that after attending to them quickly, and then they go away. So this will help the other men, because I know in their homes the ladies are supposed to be doing nearly everything themselves, even when they are pregnant. So I'm sure every man would have wished the lady to go for services quickly and come back home, maybe look after other children or maybe prepare food for him and the like. So this is the starting point. We want to motivate those who come so that they go back quickly. Not that we want to delay mothers when they come. The numbers are always many, and once we see the numbers are many, we pick those who have come with their spouses quickly, which we hope can serve as motivation. But when all of them now come with their spouses, we shall also devise another means of ensuring that we try to motivate them to keep coming. We were looking at the number of mortality rate as a maternal mortality rate. Yeah. Okay, we have what we call the facility-based mortality or institutional-based mortality. That stands at 82, I think about 83 mothers dying. But West Nile specific has not been disaggregated. We can actually get that from the Uganda Bureau of Statistics. But as a country, we stand at 189 mothers dying out of 100,000 live births that we register as a country. And definitely districts have specific variations. The DHOs can actually tell you how many mothers they are losing out of 100,000. But that information needs to come from Uganda Demographic and Health Survey report, that is the UBOS, Uganda Bureau of Statistics, so that we can have that. And I'm very, very sure in the coming, actually this year, that can be disaggregated, because we still need the data from the census that should speak up to the sub-county and parish level, and that is still being done, and we do hope that can be done. But for now, you just know that there are 189 mothers who are dying out of every 100,000 live births that we register, which of course is still very high, although it's a reduction. But as I mentioned, we don't want to hear that a mother dies, because it happens in other countries. Actually, other countries are registering one or even less than one. So if it can happen in other countries, it can actually happen here. For it to happen, we need to put our acts together. We need to work together with the healthcare workers. We need to work together with our leaders, and I think this is possible if we all work together. Probably they have their own reasons, and that explains why we need to work together. The members of the press, the media, need to get all the facts and the benefits of antenatal that the mothers need to listen to. When we have your radio programs, especially health programs, please try to let them understand the importance, especially from this launch. You should be able to let them know the value antenatal care plays in as far as the outcome of birth is concerned. But specifically, if we know that there is a difficult community, we can actually engage the local leaders. We can engage our village health teams where the community health extension workers are. We can engage them and ask them to speak to these people. I know there are not many. There could be isolated cases, but we need to speak to them, hear their side of the story. What is their worry? What is it that they have not appreciated about this service? Once we get to know, then we can actually give them the facts and try to see how we can change their mindset. But definitely every human being is different. People perceive things differently. We have to listen to their story, and once we listen to their story, we will then tell them the story that we think is correct, and which story should be able to be for their own good, but not coercing or forcing them, but we need to persuade them. Unless they become of public health concern, then that's when we can probably use enforcement. But for those who don't want to come, definitely we'll try to talk them out of that, because we know scientifically the benefits are there. You've seen we are now losing less and less children, we are losing less and less mothers, and that only cannot be by accident, but it's because at least something has been done. And in this we need to be together. We want to call upon the members of the media to be able to join hands with the health sector, to be able to carry out our messages. We can't be everywhere, but we know just one message from a media house will reach thousands and maybe hundreds of thousands. And that's why we are very proud of you, and we do hope that you continue partnering with us. And as a ministry, we'll also try to see how we can actually support you to be able to reach out to as many of the communities as possible. we really want to see that this campaign gives us results. We'll definitely do an evaluation after some time. Normally our campaigns run for a couple of months and then we evaluate, and once we think that it is achieving the kind of results that we want, then that's when we can strategize. But for now, we are going to continue with this campaign, and hopefully after a couple of months, maybe 6 months, we can actually evaluate and see, are we actually making any strides? Is there any way that we can re-strategize and change it? I think that's what we are going to do collectively.
Nelson Drotin. I work for S4P Group. This is stands for Solutions for People's Group. I work closely with the Ministry of Health and UNICEF. This is entirely a program which is being run by Ministry of Health with the support from UNICEF. And Solutions for People Group is just an organization that has come in to support and to roll out the ANC campaign. The ANC campaign I'm talking about is the I Am Hakipa campaign. In our local language, we call it Mapa Adoni Tepere campaign. And this campaign is running in the whole of West Nile. The official date for the launch of this ANC campaign, or I Am Hakipa campaign, is 20th of February 2025. And right now, we have successfully concluded the official launch. There are a team of representatives from all the districts from West Nile, represented specifically by the DHOs, the DHEs, and the ADHOs for maternal and child health. We also had special participants from health centers and hospitals and regional referral hospitals. These particular categories are the in-charges of maternal and child health department. They are in-charges of those facilities who specifically handle issues to do with maternal and child health. Yeah, the campaign is to raise awareness and improve on the uptake of ANC services in all facilities. Uganda in general actually has not been doing well in terms of their cases of maternal and newborn deaths happening in many places, and Uganda is actually one of the leading countries that is not doing well in the area of facility deliveries, and also when you register the number of deaths as a result of not maybe attending all the ANC services and also delivering the health facilities. So Ministry of Health came together with UNICEF, with support from UNICEF, to ensure that a lot of awareness creation is done to generate demand for services for ANC. Our most important focus, the policy for Ministry of Health, is to ensure that mothers who are pregnant should be able to start their ANC from the first time when first month when they miss their periods. So the only way they can confirm that they are pregnant is by going to the health facility and the test to confirm whether they are pregnant. And the moment they are pregnant, they are expected to continue going for antenatal care on monthly basis for up to 8 times until also when they deliver in the health facility. So this is very, very important in taking care of the pregnant mothers. Why we emphasize on this is there are a lot of health information that is provided there, and there is also a lot of services that are provided at the health facility, like checking the blood of the mothers to know if they have any other diseases, to check their nutrition status to see if they can feed well. There are so many other things that they give, and also other drugs that they give them, so like also Fansida for malaria prevention in pregnancy. So there are many other programs that actually help a lot with mothers. And why we are focusing on this is we know the community. For a mother to be taken care of, to be a real keeper of a pregnant mother, it's not just about the husband and the wife alone. The community where this mother comes from need to be supportive. The mothers-in-law need to be supportive. The relatives around, the elders within the community. So everyone, including the political wing and also the health workers. So why we have specifically launched this is now to bring and showcase how we really need to support these people and to also portray the benefit of attending antenatal care. and also how it will benefit the mother so that they are able to, she is able to deliver a very healthy baby and be able to live a very healthy life. So this is really the focus of this campaign. The I Am Her Keeper campaign is focusing on bringing on all different stakeholders on board to ensure that everyone is supportive to a pregnant mother. There are cases where there are cases of pregnancy among young people, let's say adolescents and also young mothers. Some of them could have been in school and they have gotten pregnant. Well, we as parents, as a community, would expect that these children should have been in school. But however, what do we stakeholders right from the community, from the family to the community, and also up to the facility. So all these support from different levels are very, very important. That is why we are calling upon people to support and work together. From the drama skits that we had played here, shown here, others were trying to portray the environment where these pregnant mothers come from, which sometimes hinder them from attending ANCs. They are at the facility level. It was also portraying the environment within the facility level sometimes, which also scares the pregnant mothers. And then at the same time, there are also some skits which are portraying how we should actually ideally support these pregnant children, so that pregnant mothers, so that they are able to feel comfortable and be able to access these services right from the community. At the community level, there are VHTs. Within the families, there is a mother, there is a father, there is the husband, every other people within the community, within the family, within the community, and also at the facility. The midwives and the facility staff also need to welcome them and provide them all the necessary services. If we can achieve this, then we are hopeful that the pregnant mothers will live a very healthy life, and they will also give birth to very healthy babies, and they'll be able to raise their children.
How long is this campaign expected to run?
This campaign is going to run for up to 5 years. It's going to run for up to 5 years. And we are running it with different programs. There are radio programs that are going to be running on. There are going to be also some dramas within the communities. There are also going to be other ways of mobilizing communities to ensure that they are able, mothers or pregnant mothers are able to actually attend ANC services up to 8 times, and then also, most importantly, deliver at the health facility. One other aspect we are actually tackling to ensure that actually we realize the dream of having pregnant mothers actually deliver healthy and successful in the facilities, is to engage the men. Our biggest challenge has been the men when it comes to support of mothers, taking them to for ANC. So we really call upon all the men to be exemplary, love their women, their wives, and support them. Once they conceive, they are pregnant, they need to they should escort them. The information that is delivered to pregnant mothers in the facilities is not only for the mother. It's also very, very important for the husband, because in our traditional society or in our traditional culture, men are the decision makers in the community. So in the facilities, for example, they may want this woman to be dressed well, to be clean, to dress on this maternity dress, which will actually make them free when they are moving, when they are still pregnant, and many other requirements at the facility that the women themselves sometimes they may not afford. But with the support of their husband, they can easily get these services. For example, transport for this mother to go to the health facility. The man has to actually be in that support. Maybe it may require selling maybe some kilo of beans to raise money to go to the antenatal service. But this woman cannot take that decision independently. It will require the man to actually decide on that. So if the man doesn't understand, we are expecting that with the campaign, since we are now taking this campaign to the district level, that's why actually we invited all the DHOs, the DHEs, and the ADHOs, maternal and child health, who are directly working with these mothers, is to now take this campaign to the grassroots level, at the facility to the sub-counties, the facilities within the sub-counties, and even in the communities. And when we do that, obviously we will be able to, the ANC services, uptake of ANC services by pregnant mothers will increase, We hope that it will increase. We hope that with this campaign, men will be sensitized and they will be able to appreciate and understand the benefit of ANC, and they will become supportive to attend, to go and attend ANC services. And above all, we will be able to reduce maternal neonatal deaths, which we are experiencing in many facilities and across Uganda. So our focus is actually to reduce maternal and neonatal death in our communities. When we can achieve that, I assure you we will be having a very responsible husbands, very responsible mothers, and be having very healthy and children who will grow up and will be leaders and also to support us in our community in the future. Thank you.
Once again, your name?
I'm called Nelson Drotti. I work for S4P Group, that is Solutions for People's Group, entirely supporting ministry and in the ANC Heartkeeper campaign supported by UNICEF. Thank you.